and good afternoon, everyone. So in today's era of digital health transformation, choosing the right system is only one facet of a successful implementation. Clinicians are actually at the heart of any of these changes, serving as both key users and important business drivers in the hospital. So the challenge actually lies in how we can ensure that these clinicians adopt and embrace all of these changes. So that's why we gather here today with three amazing panelists to discuss the important issue, how we can ensure that clinicians adopt and derive benefits from any digital health initiatives. So as a start, I would like for each of you to provide a brief introduction about yourself and your organization. Dr. Tullawat, would you like to start?
Yes, hello. I'm Dr. Tullawat from Vejthani Hospital. I'm served as a Chief Operating Officer for Vejthani Hospitals, and I also serve as a board member for ACS PACS Advisory Board. The Vejthani Hospital is a tertiary care hospital in Thailand, one of the medical tourism destinations. And we have just completed launching the new West Track Care versions, MEUIs, last month. Yeah. So this is, I'm happy to share our experience.
Thank you, Dr. Tullawat. Next, Dr. Bella.
Hello, everyone. I'm Dr. Bella Desra. I'm working as a physician informatics at EMC Healthcare. And as we know, in a world where technology and healthcare are merging rapidly, I found myself uniquely positioned to bridge this dynamic dual healthcare and technology, and especially how this technology really impact the doctors and other medical professionals. And I'm really glad, I'm honored that I'm in this journey with EMC Healthcare as an institution that strongly support these digital transformations. And today, I'm here to share my experience and highlight the challenge and valuable lesson learned that we already have throughout our implementation process with Track Care. So EMC Hospital itself aims to become a digital hospital, and with national and international recognition. So well-functioning of hospital information system is a key to achieve this vision, and that's why EMC Healthcare has chosen Track Care for its solution because it's aligning with our commitment with this transformation journey. And our implementations with Track Care began with the shift from paper-based into MUI, and we initiated our implementation at our first hospital in December 2022. As of now, 3 of our hospitals have adopted Track Care, and additionally, 5 more hospitals in the line that we're going to implement. And by the end of this year, 2023, our plan is to have a total of 6 EMC hospitals that fully equipped with Track Care. Thank you.
That's amazing. Thank you, Dr. Bella. Next, Dr. Nana.
Hi, everyone. I think a lot of you know me already. I'm Nana Khunlertkit, a Professional Services Director for InterSystems Southeast Asia. My job is to make sure you have a smooth transition from your OEHR or from Track Care from an older version to a newer version. So I'm in charge of the implementation for Track Care in Southeast Asia.
Okay. Thank you, Dr. Nana. So as we know that making sure that clinicians adopt any new digital health initiative is a formidable task. So I would like to go back to Dr. Tullawat.
Yeah.
So as a COO of a very big international hospital with over than 300 specialists under your care, so what do you think are the key challenges in this clinical adoption? And after you upgrading the Vejthani Hospital upgrading to MEUI, so what stories can you share about the key challenges there?
So if we look at the data from this morning and this afternoon as well, you can find that the EMR vendor represents only 33% of success, and 21% is from organizations, but 46% is derived from users. Therefore, the key challenge is to manage user perceptions. And there are 3 kinds of user perception that we have to manage. The first is perceived benefit. The second is perceived complexity of the system. And the last one is perceived incompatibilities. So we have to try to win those perceptions of user, to let them get involved in choosing the system. So let's start with a perceived benefit. I think we have to try to overweight the perceived benefit. But from research show that in the initial phase of implementations, most users not focus on benefit, but will focus on the incompatibilities and complexity of the system. So the way that we do is we have to have a PR, public relations, to convey the benefits clearly to the user. So our practice is we let each specialties, each clinician, each professional try to come up with what are the benefits that the clinicians will have after implement the new system. This, you have to have the powerful PR, internally. The second is perceived complexity. Right now, I don't think there must be problem because the software vendor have developed the system that quite easy to use. So I pass to the last one. The last one is perceived incompatibility. This is really challenge because incompatibility will happen even though the system is well developed. Why? Because the system is developed in different contexts with different workflow, with different practices. So it's impossible that when you adopt the system, user will feel that the system is completely compatible with their work style, with their workflow. Therefore, we have to manage it. And don't overweight to manage incompatibility in early stage. Why? Because you will come up with not go in line with what workflow that the system design. So the pitfall is you try to fix all feeling of incompatibilities too early. And then you have to lose some functionality of the system because you try to customize the system, so far and so forth. Let me give you some examples. When we launched MEUI, because our doctor get familiar with using questionnaires. And after this, MEUI have a feature what's so-called clinical note. That's very good because with clinical note, the doctor can see all things in one page in EPR. But by that time, we consider that the doctor feel very incompatible using clinical note. Therefore, we decide to use questionnaire. And right now, we have some kind of problem because after doctor use for a while, we have the problem of doctor would like to see all the medical record in one page. Encounter record, lab result, X-ray. That's impossible if you use questionnaires. Now we face the consequence of making the wrong decision. So at this point of time, for incompatibilities, you have to balance between let the user accept the system and try to maintain the functionality of software as it is. Okay, that's all for this round.
I think quite the important point is to maintain that balance, right? Yeah. So I think I would like to move on first to Dr. Bella before discussing deeper about your strategies. So EMC hospitals just successfully implement the MEUI in 3 hospitals under 2 years, with plans in implementing MEUI in 3 hospitals by the end of this year, which is amazing. So do you have any strategies that you can share to us today, how you managed to overcome the clinical adoption challenges?
So addressing a challenge effectively, our strategy first, we maintain open line communication with our users and our management. We regularly share and updates to them, like how the process of the training, how the system workflows directly to them, and we also addressing their consent. And the very most highlighting, we have to make sure that all the users is completely understand the purpose and the benefit of this system by providing them the overview before we start the training so they can really understand the workflows in the systems. And secondly, we do providing customized training, a personalized training for the different role like a nurse and doctor so they can feel more confident when they use the systems. And the third, of course, about strong leadership. a strong commitment from the management itself, from the top down, is very essential, because the management needs to be active and involved with this transformation and setting a positive tone so the others will follow. And the fourth thing is about providing an ongoing support even after the initial implementations. Like this, including we provide them with help desk for the users, and we also made a video tutorial about what's new in these features and how the tips and tricks for the users, and we do have a monthly evaluations.
Okay, and you're also a clinician yourself, and your position interacts closely with the clinician and users, and maybe facing the resistance directly to you. So how crucial do you think is the involvement of doctors inside the implementation team?
Okay, so having a doctor as a part of implementations is highly valuable and crucial, because physicians really understand the practical aspect of patient care and can really offer the insight about how technology can be integrated effectively into workflows. And the way we keep the doctors engaged with us is we are always involve them in every phase, like from planning to training, and we also get an ongoing engagement with them by open line communication. We share ideas, we share updates to them, and we identify their common problems, and then we listen to their ideas. So when they really feel like their opinion and ideas are matter, they will stay connected with us. And about the effective training that we're doing in the field. So this is the role where the doctor in the implementation teams comes in. Like we do customize their personal training for our doctors, and we do customize their needs, like the favorite orders and their diagnosis orders, and also even their compound drugs. We're setting it so it's gonna make them feel confident and make it easier for them when they use the systems. And also we always learn from every implementations. We assessing the key points, we assessing all the key points that doctors needs to know first, and we identify like the common mistake, the common problem from users, and based on that we develop a module that contain key points of what doctors needs to know first. And yeah, that really helps to have a focus and very effective training, because track care really has a lot of features, and there is tough enough to learn all of these features in a short time. So that's why we made a basic module, so it will covers that all the key points that doctors have to know first, so they can get a better handle on track care later on.
Okay, that's wonderful, because I think building an effective training is so important part in maintaining clinical adoptions, because sometimes the same training with the same system, with the same team might result differently. Correct. Which pins down to the human factor, which brings me to Dr. Nana. Because you have so many extensive experiences in dealing with many people in different cultures, you have also extensive experiences in the human factor. So what do you think is the key challenges in the clinical adoptions, and do you think that change management process also crucial in this part?
Yeah, I think absolutely yes, right? Just like the two doctors that mentioned before, that we have to engage end users into the process. We have to have key users who can communicate to the end users and to be able to articulate what's the benefits they're going to get after the implementation. Because of course, there are going to be some compatible functionalities and some incompatible functionalities that you have to go through. That learning curve that's always high for any EHR implementation, we have to overcome them. So of course, change management is very, very crucial. And as a vendor, we're here to help you. And we understand that not every organization has change management or change agent within. So we are here to help. We are here to help you creating the plan to move forward with the implementation successfully.
Okay, that's wonderful. So, and Dr. Nana, I think Dr. Tullawat earlier mentioned about the perceived incompatibility, that many sites tend to do it early, the perceived incompatibility, and they make change requests for the product to fit their workflow better. But sometimes it's not about changing the products, it's maybe changing the workflows first or changing the people. How would you usually respond to this kind of request?
you know, when you ask that question, you bring all smiles on the face of the people over here, because I know a lot of people have been burdened with all the change requests that they put in queue, right?
Yeah.
And you know, coming from a vendor, I never say no to a change request, but you know, I always go back and ask a lot of questions around that change request that you make, because to the end point, what Dr. Tullawat said is very important, that it's not just because you want it and you will get it, but if you get something that you wanted, but it is somewhat, it's not a good solution for you, I would want to try to forbid that to begin with. So you don't have to come back and do the re-implementation afterwards, which actually will be a burden to everyone, right? So I would say no, we don't say no to change requests, but we spend extra amount of time trying to understand what you really need in order to find something that best suits with what you really require from us.
Okay. So back to Dr. Tullawat. Now you just mentioned about all these challenges. So as a COO, how you manage to deal with these challenges or strategies, or what kind of approaches did you do to achieve a successful clinical adoption?
Yes, I strongly agree with Bella in terms of get doctor involvement as much as possible, and I also agree that how training is not just a classroom training. Classroom training represents only, I think, less than 20% of success factor. In-person trainings, help desk support, and all kinds of tactics that you mentioned are very impressive. And I also agree with Nana that work closely with vendor to discuss truly about how the system designs, what are functionalities, what are workflow behind those functionalities is very crucial to make us take the right decisions. But I would like to add on some things. First, what we use is gradual implementations. Honestly speaking, we adopt TrackCare new version MUI since the middle of 2021. And right now, this is 3 years. We have just finished implement medication management last month. So it takes time 3 years. The first half of the years, we do technical upgrading. And we spend 1 year to implement MUI's specialties by specialty. So we implement MUI few specialty at a time. Why? Because of we have to make sure that the support team is available in place, because we have limit our personnel for IT teams. And we can learn from doing things and fix the problem during gradually implementation for specialties. And the last reason is because the other doctors can learn from their profession, they can learn from their college about implementation. So I think this is a good tactic to implement just gradually implementations. And another thing is the one thing that I would like to advise is to go global versions. Because we are not IT company, I don't think we have enough staff to develop anything. Therefore, I think go for global versions, truly understand how system work, and use system as it's supposed to be. And another thing is you have to make sure that you include all case scenario in each business process when you do a UAT, user acceptance test with vendor. So make sure that you include all, or else you will face problem. So this is 3 main things. First is to do step-by-step gradual implementations, go global editions, learn how it works and use it correctly, and include all case scenario in each business process during the UAT.
Yeah. So I think one important point that I also think is the second one is to, rather than changing the products, every product to fit the workflows, there's a benefit, when you implement the product truthfully. Dr. Bella, can you add something more about the personalized training that you mentioned earlier about the strategy, how you design that effective training, and sometimes maintaining the ongoing engagement to the doctor sometimes harder than build the motivation itself. Can you share any experience on that?
Probably it's yeah, the same like before. Yeah, we provide them with customizations of training, like the modules on they'll have their roles like for each doctors and also with a nurse. And we do provide customize their needs, like their favorites, their diagnosis, their compound drugs. And we make a modules that based on what their regular basis. So it's more engagement for them, something like that.
I see. Okay, so I think we're almost at the end of our discussion. I still have one final question to our panelists. It's about how you define a successful AMR implementations in terms of clinical adoption and overall impact on patient care. Maybe starting from Dr. Bella.
Okay, so assessing success implementations EMR, I do agree that it involves two key aspects, the clinical adoptions and patient's care impact. And for the clinical adoption itself, we'll look at the usage rates and how the system can really integrate it into workflows, and how track care can really help a doctor when they're assessing their patients. Because I have to mention a noteworthy about aspect about track care, that is about how track care can really sort the patient's visits like an episode. And before I'm using track care, like as a doctor, reading patient's record is meant like a lot of searching. So it is so incredible that track care can really sort the patient's info by episode and making it so engaging and making it so easy for doctors to see. And it was like, I was thinking like, it's not just reading a patient's record anymore, but track care want us to watching the patient's health journey.
It's more engaging.
Yeah, it's more engaging. And we can see, I can feel that when the patients get assessed, doctors can really feel like the situation in the previous episode. We can really understand like how the patients got transferred, for example, like emergency episode to inpatient episodes, because we can feel like the situation surrounding patients on that episode, and the doctors will get the full picture of patient's conditions. And in a sense, for me, track care is just taken a patient's record from being just a static document into dynamic narrative, and it is way much more engaging. And for the patient care side, we do evaluate improvement from our patients and doctors' communications and patients' care quality, and we have the reflected from the positive feedback from our clinician and our patients' engagement. Like I have a bit story about this. Like that day I was with one of our doctors. We're going to visit our patient that has been hospitalized for a while. And as we know, track care has a display icon next to the patient's, display icon next to the patient's details that can provide us with the quick info with the patient's details. And on that particular day, as I can remember, something caught our eye. It was a birthday icon next to the patient's info. And I was just realized that icon exists that day. So I was like thinking, okay, track care is trying to give us a hint that our patient is having a birthday that day. So after our doctors is visiting a patient and explaining the patient's conditions, in the end of the visit, our doctors wish the patients a happy birthday. And I can't really forget, I can really see that the patient's face lights up with a surprise and happiness, because she had completely forgotten that it was her birthday, of course. And in the other side, our doctors, got reminded by the track care, by the icon, and it was just incredible how the simple thing like icon can really make an impact to our patients, that patients can really feel cared for. And I can imagine the technology like track care as a friend for doctors to have a better communication with their patients. And for me, the success of EMR is the balance of effective technology integrations and improvement in patient's experience also.
So, I mean, just like an icon can also like improve, right, to show that the doctors care about the patients. I can't even remember the last time someone wished me a happy birthday besides my mom. So, Dr. Tullawat, how would you determine a successful AMR implementation? And after you upgrading to MUI, is there any benefits that your hospitals get from it?
I think the successful will measure from users adopt full functionalities of EMR. As a result, this will lead to patient safety and good workflow as well. And it's also come from the data, quality of data that we can get from the system that we can use to do a data analytic later. So I think this is the meaning of successful implementation for me. But for benefit, I think there are many benefits for sure. Right? So I just curious why you start with challenge instead of benefit. Yeah, there are benefits because drug safety, of course, for sure. Drug interactions, drug duplication can check cross-visit. So this is very safety. In terms of information retrieving from the system is very fast and very organized. And the new features such as like nursing care plan, administration timelines, clinical encounters, all kinds of features are very good. I think so. There are many benefits. The challenge is the thing that we have to cope up with, but the benefit for sure you can get it if you implement it and you fully use it correctly as it's designed.
Okay, thank you, Dr. Law. So that data usage and good data usage. Okay, so for closing statement, Dr. Nana, how would you determine successful AMR implementation? And is determining the successful AMR implementations is primarily the responsibility of the vendor or the hospital?
I think I'm going to address the second question first because I think it's clear to everyone now that it's not just only our responsibility, but it's a shared responsibility between all the parties, vendors as well as the hospitals themselves, as well as the executive and all the levels of users in the hospital. For the success, I think this is a very good example how we can measure the success, right? So from an honest feedback that we receive from here, positive feedback, how can our systems can help you improve the operations in the hospital and improve the hospital performance after all. I think this is then a very good example of how we could measure our success.
Thank you, Dr. Nana. So thank you for all the panelists for all the valuable insights today. Unfortunately, due to our time limitation, we won't be able to take extra questions from the audience, but we do encourage you to approach our panelists directly after the session should there be any questions you want to ask. So thank you for the panelists. I think in today's sessions, we learned a lot about how to tackle the challenges in the clinical adoptions so that we can derive maximum benefits of any of the digital health initiatives. And I also want to remind you that any new digital health initiative is not a static journey, it's an ongoing journey. It doesn't stop at implementation. And this conversation is merely just a starting point, and the real value lies on how we move forward with the actionable points that we get from our experts today. So thank you for all the panelists, and thank you very much to everyone today.
Thank you for having me.
We'll take our final break for the day now and return at 3:15.